I'm Neil O'Neill of Pursuit Physical Therapy here in Redmond, Washington, and I specialize in autonomic disorder. And most people in the context of physical therapy don't maybe know what that exactly means. So to put it in perspective for you, the autonomic nervous system is an automatic nervous system that maintains health, responds to disease, also gives us our training effect, and governs growth and response to the environment. So you can see that it's broad ranging. But in that, all those aspects of what the autonomic nervous system does is so much of what makes humans healthy or dysfunctional or diseased. So in that vein, I do want to talk about how the sympathetic nervous system and the parasympathetic nervous system, the two parts of the autonomic nervous system, work together to provide health and to provide a means of training effect, response to disease or to colds. So definitely one of the parts of the sympathetic nervous system is its ability to govern response to training and response to foreign invaders. So we call that our adaptive immunity, that it adapts to the environment, learns from the environment, and it develops a means of defeating foreign invaders like viruses, bacteria, etc. But in that, it also sets up our training effect so that when we respond to, we have a nice, good, hard workout, and we allow that sympathetic nervous system to do its job of setting up a healing response and setting up a response to the insult to be able to meet it better the next time. That also provides us this awesome ability to train and to build and become better at what we do. The parasympathetic nervous system, however, holds a slightly different role in immunity, and that role is what we call innate immunity, in that it understands, it really reads what is self and what is not. So it attacks things from a very different standpoint, a very different viewpoint. And in that, it really recognizes self, unless something happens, like say there's a viral infection and the virus is expressed on the surface of the cells, of certain cells in your body. So for example, COVID-19 or coronavirus, as most people know it, attacks, and as the virus has taken over a cell and has caused that cell to produce millions and millions of virions, those virions will start to express themselves on the surface of that cell, and the parasympathetic nervous system may recognize that and come in and attack it. Now, that has a lot to do with that disease process, but what does it have to do in health? That is that vagovagal response or syncope that a lot of people have heard of. It also, that fainting, that stop, that freeze reaction when something scary is happening. That is a protective mechanism. But then, so far as other aspects of it, it's kind of the housekeeping duties. It replenishes, rejuvenates, renews, restores, brings in all the nutrients and things that you need. So it really works to keep the body working as a whole. Whereas the sympathetics kind of burn everything out, say, hey, let's go for broke, let's get it done, whether that's an athletic event or a response to an intruder or run from the tiger. All those are equal events in the sympathetic nervous system's purview. Whereas the parasympathetics are more about, hey, when's it time to sleep? When's it time to rest and digest? So that's how those two systems work. And the reason really that I bring this up and that we're having this talk is that, again, back to COVID-19, one of the bad aspects of COVID-19, the coronavirus, and so many other flus and autoimmune responses, right? There are autoimmune responses, and then these kind of sit side by side. And what that really tells us is that this autonomic nervous system, it reacts and responds, but it doesn't react and respond and then turn itself back down. And so I actually specialize in how to turn those overreactions back down. Unfortunately, one of the things that does the most damage to patients, and so for example, let's use the example of COVID-19, that people develop basically a flu with the coronavirus, but it's that the coronavirus has done its damage for so long, and the immune system becomes competent in recognizing it. First off, the parasympathetics recognize it as non-self and start destroying those cells. The cell debris and the breakdown congest the lungs, and you develop a level of pneumonia. So that's why the coronavirus continues on. It's a pretty bad flu until there's a level of pneumonia, which really means inflammation and swelling in the lungs. It makes it more difficult to breathe, more difficult to get oxygen in. However, unfortunately, because the process lasts long enough, the coronavirus is very virulent and stays with people for a long time. About 20% of the infections is what has been reported, such as NPR and National Geographic, that 20% of those infections go on to develop a full-blown coronavirus infection that causes an hyper-aggressive immune response, somewhat like an autoimmune response, in that the parasympathetics are coming in and hammering those cells that are showing virions on their surface, or virion proteins on their surface. But the sympathetics have now become, they've now adapted, right? They've seen the enemy, and they start attacking the enemy themselves. So you've got the sympathetics start coming in with the big, bombs of destruction, cytokines, et cetera, and they're destroying things. And so you've got the parasympathetics and the sympathetics. Now, instead of just a smart bomb battle, if you will, you have a just death and destruction everywhere, cells everywhere, and that pneumonia now just clogs the entire lung and respiratory system, such that the patient cannot get oxygen in at the cellular level. They cannot absorb oxygen across there. It's too much inflammation, too much fluid, too many destroyed cells. And so this hyperaggressive response actually causes the continuance of the disease process. Now, we also see this exactly in autoimmunity. It's very similar processes that the sympathetics have come in and recognized, hey, there's something going on here, mostly because the parasympathetics have started hammering at something, or the sympathetics have hammered at something, and the other side of the equation says, hey, wait a second, there's a problem there. So for example, if the sympathetics come in and they start hammering an area due to stress, they change the proteins that are exhibited on the surfaces of cells. Well, then the parasympathetics are coming in and they recognize that cell as not being self. Even though it was self, the proteins on the surface have been denuded, such that the key that says no attacking to the parasympathetics is broken. And so now the parasympathetics begin to attack, and that's autoimmunity. That's the part I specialize in, is because these nervous systems are in areas of the body. They come from an area of the body. So for example, the sympathetics are called the thoracolumbar outflow, and that's because they come from T1 to about L2 in the spine, and actually just anterior to the spine. I have a handy dandy skeleton here. Just anterior to the spine, right about where the spinal nerves come out, just in front of the rib heads, next to the vertebral body, is where the sympathetic chain ganglia, and I call them a chain ganglia, not me actually, but medicine calls them a chain ganglia because it looks like a chain that at every level, ding, 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 all the way down to about L2 on both sides. So it looks like a chain, all the way down, but inside the rib cage here, back at the back. Those chain ganglia are the sympathetic nervous system. And the thing is that offers us an opportunity to really do something about slowing down their response, or inhibiting, holding down their response. And that response for the sympathetics is huge. So certainly, as in COVID-19 and other things, and hyperimmunity, autoimmunity, is that we would take a patient and that we would do what we call a rib raising technique. Now that rib raising technique is that you put your fingers, now I'm going to do this on the opposite side of the patient's body. This one didn't live. But I'm going to do this on the opposite side of the body for you to see. And that you would put your fingers right here in the rib heads, and you want to lift superiorly. Now the way that I would actually treat it in the clinic is that I would have the patient supine, and I would come up under their ribs, so I'd be just lateral to the spine. I wouldn't be on the spinous processes, and I wouldn't be right in the gutter on the transverse processes. I'd be just lateral to that, and that can be a little difficult to figure out. But when the patient breathes, you'll really feel these ribs move. So that's one way to find your position. So what I'm suggesting here is that you begin to treat this way, and especially if, now in the United States, this is not very likely that we're going to have as many coronavirus problems. However, in other parts of the country, so if you know somebody in another part of the world, such as China or Asia or Middle East, anywhere that might be getting hit with the coronavirus, or any other illness for that matter of this nature, where the immune system becomes hyperaggressive and actually is what just causes all the damage to the patient and actually kills them, we want to inhibit those immune systems. So again, rib raising. So you found the rib heads. You're holding up under the patient. Now, you're just going to lift up and hold under the patient. And at first, their sympathetics are going to rise up. They're like, and they'll be really stiff. But over time, as you hold that pressure, they're going to relax. Okay? Now, this is very similar to a lot of exercise information about, well, lay on a ball, or a massage therapist. You talk to a lot of massage therapists or other healthcare practitioners like that it's really about calming down the system. They'll say, well, let's lay on a ball. Well, let's roll on the ball. Well, we're not going to roll on the ball. We're going to, now you could have two tennis balls taped together that would cover just either side of the spine and do the same thing where you come to a level and you hold. Now you want to be pushing those ribs, lifting those ribs, so that's why it's called rib lifting. You want to lift them towards the ceiling and hold that for 30 seconds, a minute, until it completely relaxes in there while the patient's breathing. And you'd want to go all the way from the top to the bottom and then go around to the other side of the table, treat the patient from the top to the bottom again. That helps inhibit a hypersympathetic response, but it doesn't change a parasympathetic response. Now the problem here is that there's two sources of the parasympathetics. Typically, the one that most everyone thinks of is the vagus nerve. And out in the periphery, and especially dealing with the lungs and everything, that is really the one that we're talking about since we're speaking of COVID-19 and the importance there of treating these patients. So vagus nerve comes down out of the cranium. So we call the parasympathetics the craniosacral outflow. And that craniosacral outflow is really, in this instance, vagus is what we're concerned with. And so vagus comes out and the nodosal ganglia, the ganglia, just like there are chain ganglia for these sympathetics, there are ganglia for the vagus nerve. And that ganglia is anterior to C2. So if you know how to palpate, anteriorly to C2. So it can be really difficult to palpate, but if you bring your fingers in to the side of a patient's neck and you feel, now here's going to be the problem is that the carotid artery is right in here as well. Now, so if you feel something going ba-bump, ba-bump, ba-bump against your fingers, you actually want to be right next to that, but not on that. Don't hold back that blood flow. Don't compress that artery. And this is a very difficult thing of having fine touch that you would want to hold and maintain a light pressure. And it's going to be, there will be a spot in there where the person goes, oh man, and it's a little nodule. You might not so much feel the nodule, but you'll know that you're next to it because you're right next to the carotid artery, and you'll be at about C2, anterior C2, the front side of C2. And you just want to hold that. And what I would do is I would suggest holding that, or holding your fingers up under those ribs again to the sympathetic chain ganglia, and treating this and hold. It's the way to cause inhibition of these nervous systems, these aspects of the nervous system, is to hold your pressure for a longer period of time, gently, firmly. Don't move around. As my friend Dennis Eaton says, my co-teacher in ANS Balance, he says, don't slobber all over the patient, so don't slobber. However, you want to hold that pressure, you want to push that and hold that here, or while maintaining that pressure on the anterior C2 next to the carotid artery, get in between the ribs here, the tissue, the intercostals in between the ribs and the pec minor, pec major. So you want to hold or even gently rub on the inferior hand, the more caudal hand, rub into those spaces there. And the patient will be very, very tender. So really, ribs 1 through 6 are long. Okay? So we want to hold that vagal pressure, an anterior C2 at the nodosal ganglia. So you can look those terms up. We'll have those printed on the screen for you. Because of the segmentation of the human, the segmented way that we are set down, you want to rub in those muscles gently, but firmly, in a slightly rotatory manner, all the way through that rib cage. If you get something that's particularly touchy and the patient keeps kind of jumping at it when you rub it, that's a press and hold. Okay? And that's how you read the nervous system. That's how you read the sympathetic, parasympathetic nervous system, is how it responds to what you're doing to it and how you're trying to get it to calm down. Now, if you can get that part to calm down, what you'll find is that your patient may feel sicker, but will recover more effectively. And that hyper-aggressive response, unfortunately in the case of the coronavirus, the COVID-19, is killing people. So one of the ways to get that 20% of the population out of that area, and actually if you're treating them when they're in the stage of pneumonia, and I'll repeat, so the coronavirus, you become infected, it takes 2 to 14 days for it to really offset depending on the health of your lungs, and it progresses from a cold-like flu symptoms on into pneumonia. That's the point at which you really won't have to be treating these patients. As they're developing that pneumonia, you want to actually try and stop that pneumonia. Now, the osteopathic physicians and Dr. Frances Marion Pottinger He was famous to me and to several others. MD in the 1900s, he had a sanitarium for tuberculosis treatment, and so he discovered a lot of the aspects of the neurology of how organs are innervated and where those nerves run and how to work on those. He specialized in tuberculosis, but COVID-19 has a very similar process, the infection of the lungs and the destruction of the lungs, lung tissue, and the attacking by the autonomic nervous system. So that's why his information is so valuable to us. Of course, it's kind of been forgotten, but you can go and find, treatment of visceral disease. You can go and find his book. It's on Google Books, and read through his stuff. It really uses the neurology that we've known since the late 1800s, early 1900s. That was the forefront of neurology, and they really discovered all this stuff. And unfortunately, medicine took a left turn. We're more interested in products that can be sold, or something that can be done with very little technical training on the part of the person doing it. Unfortunately, this kind of treatment requires technical understanding of the person doing it, which is why I'm providing you that technical understanding, and that you're going to have to work with this. But that this technique, this approach, I've used it to get patients to a minimal amounts of medication for Crohn's disease, other autoimmune disorders. But you have to have that knowledge base. And so, since this is such an important aspect right now, and we have plenty of people dying of the flu all the time, similar treatment, same treatment, in fact, whether it's COVID-19, any infectious agent of the lungs and chest are going to be treated this way to keep that patient from going past a point of recovery. And like I said, if we can bring the hand-holding health providing aspect of the sympathetic and parasympathetics, the autonomic nervous system, back into line, these patients will do really well. And so you can help keep these people from ever progressing to that point where the medical community is going to have a very difficult time treating them, especially in situations such as is going on in China, where the healthcare system, the entire system is being overwhelmed by the sheer number of people rushing to the doctor. Now, the same thing's going to happen here in the United States if this ever got a foothold here. Everyone's going to rush to the doctor, and unfortunately, 80% of those people don't need to go to the doctor. But how do you know if you don't need to go to the doctor, especially if you progress to that pneumonia-like stage and you're ill and you don't feel good, you're afraid, then everyone rushes to the doctor, and that 20% that really needs to go to the doctor can't get there. If you happen to find yourself, or you know of somebody in a community where that's what's going on, this is the treatment technique I would employ. If it were my kids, my spouse, my friends, somebody that I was around and I knew I was already exposed, I would, and if you're already in a community, you're having to stay, if you're one of those unlucky people who's stuck on a cruise ship, you don't have to be trained in how to do manual therapy. If you just take what I just told you into account and look at it, look up some of those terms on the internet, figure out where that's at, and try to keep the people around you from getting a hyper immune response, and that because that's what's killing people with COVID-19 and with some of these other disease processes. So I hopefully that's helpful. Hopefully that can help you keep somebody from going too far down the health line, the poor health line, before medical help can really get there. Obviously, medical care, don't use this instead of full-blown medical care. If you can get access to full-blown medical care, if you can use this in conjunction with medical care, it makes it work far better. You have to get the nervous system responding to each other appropriately. When it gets out of whack and stops right hand holding, then that's when you get real problems with patients. Hopefully that helps. Thanks again.